So something you might not have thought about in terms of your aesthetic practice or your aesthetic practitioner, or something that you might not even realise we do deal with, is women's health issues. So a large proportion of our patients are female, and a large proportion of females have had some sort of women's health issue or problems down below at some point. Now, in general terms, that's as time goes on, as we're a little bit older. You may have had children, you may have had surgeries, you may be approaching, going through, or after the menopause, but all of these things can contribute to a whole host of conditions down below. So that might be dryness, it might be a loss of kind of elasticity, it can be urinary incontinence, which women are really reluctant to talk about, but is actually much more common than it should be. There's a whole variety of things that you can do out there via your doctor, medical treatments, surgeries, but something which we're able to offer here is targeting the tissue down within the vagina and the vulva and the collagen, which has been lost over time. Now, if you've ever been for a consultation with any of us, you know we talk loads about collagen and how that affects the facial structures, but it affects everywhere else as well. So collagen is what keeps things kind of nice and tight and elastic and healthy tissues. I have a device in clinic called ThermiVA. ThermiVA is a radio frequency device. Now, what does that mean? It means it uses a heat-based energy to try and stimulate the cells in the skin or the tissues, wherever that is, to increase the amount of collagen that's there. And what kind of effect does that have? If we can increase collagen, that can help to improve the overall quality of those tissues, their overall functioning, the tightness, the elasticity. And in turn, that can have a really positive impact potentially on whichever health condition you've got down below. That might be dryness, that might be the loss of elasticity, or it might be even sexual satisfaction that's improved from that. We go through a really thorough consultation about your needs. You would come in for an examination with me, and then we do 3 treatments about a month apart. It's very minimally invasive, it's very well tolerated, and doesn't take a whole lot of time, probably about 40 minutes within clinic for you to potentially see a really good impact down there. We also talk through your other concerns, your hormonal concerns, and we have a dedicated women's health doctor who works with us here in clinic who can talk to you about things like HRT and more specific concerns if that's something that's interesting to you or something that's applicable to you. Overall, I just want to say, please don't be shy in mentioning these concerns. This might not seem like the place you had thought that we could help, but there may be options out there, and I'd be more than willing to have a chat with you about it at any point.